Some women feel relief, some feel grief, some feel both in the same hour. For decades, society told women there was only one correct emotional response to abortion, but science tells a far more complicated story. Today, we're separating myth from research to answer a question millions of women have asked themselves in silence. What does the evidence actually show? If you've ever wondered why two women can go through the exact same medical procedure and come out with completely different emotional experiences, you're about to find out. And by the end of this video, you'll understand something that even some healthcare providers don't fully grasp: the real factors that shape how a woman feels after abortion, and why guilt, relief, grief, and peace are often not opposites but companions. Before we go further, let's be clear about what this video is and isn't. This is not a political video. We are not here to debate the legality or morality of abortion. This is a health education video built on peer-reviewed research, designed to help women and the people who love them understand the emotional landscape that can follow this experience. If you're someone who has had an abortion, this video is for you. If you're a partner, a parent, a friend, or a healthcare worker trying to understand and support someone, this video is for you too. So let's get into what the science actually says, starting with one of the most misunderstood pieces of research in modern reproductive health. For years, public conversation about abortion and emotion was driven by assumption rather than data. That changed significantly with the Turnaway Study, a landmark research project conducted by the University of California, San Francisco. Researchers followed nearly 1,000 women over 5 years, comparing those who received an abortion to those who were turned away because they were past the gestational limit. This was groundbreaking because, for the first time, scientists could compare real emotional trajectories over time, not just snapshot opinions. And what they found surprised a lot of people. The most common emotional response reported in the days and weeks following an abortion was relief, not guilt, not regret, but relief. In fact, the study tracked emotional well-being over 5 years and found that the overwhelming majority of women did not regret their decision even years later. But and this is the part that often gets lost: relief does not mean the absence of other feelings. Many women in the same study also reported moments of sadness, ambivalence, or grief, sometimes in the very same week as relief. Emotions, it turns out, are not a single light switch. They're more like a dimmer panel, with multiple feelings turned on at different intensities, often at the same time. The American Psychological Association's Task Force on Mental Health and Abortion reached a similar conclusion after reviewing decades of research. There is no reliable evidence that abortion in itself causes mental health disorders in the general population. That's a significant statement because for years, public discourse assumed a direct, almost automatic link between abortion and depression. The data simply does not support that as a blanket rule. So why do some women still struggle emotionally, sometimes for years, while others move forward with relative ease? That's the real mystery here, and the answer involves something most people overlook entirely: biology. When a pregnancy ends, whether through abortion, miscarriage, or birth, the body experiences a rapid hormonal shift. Levels of HCG, estrogen, and progesterone, hormones that had been rising to support the pregnancy, drop sharply within days. This is not a psychological reaction, it's a physiological one. And it's well documented that rapid hormonal shifts can influence mood, sometimes producing symptoms similar to premenstrual mood changes, but more intense. This means that some of the emotional turbulence women report in the first 1 to 2 weeks may have less to do with the decision itself and more to do with their endocrine system recalibrating. Understanding this distinction matters because it helps women avoid pathologizing a temporary biological adjustment as a permanent psychological crisis. But hormones are only part of the story. To really understand the emotional aftermath of abortion, we need to talk about the spectrum of responses women report, because how does it feel is not a yes or no question, it's a landscape. In the short term, the days and weeks immediately following the procedure, many women report a mixture of relief, fatigue, mild sadness, and emotional sensitivity. This is often comparable to the emotional adjustment period following other major hormonal events like childbirth or miscarriage. For most women, this period is temporary and resolves on its own as hormones stabilize and life returns to its rhythm. In the medium term, weeks to months later, some women report what researchers call anniversary reactions. This might mean a wave of emotion around the due date the pregnancy would have reached, or around the anniversary of the procedure itself. Others describe a process of identity reflection, thinking about their values, their relationships, their future, and how this experience fits into their broader life story. This isn't necessarily distress. For many, it's simply processing the same way people reflect on any significant life event. Then there's a smaller but very real group of women who experience more prolonged emotional difficulty, symptoms like persistent sadness, intrusive thoughts, anxiety, or a sense of grief that doesn't ease with time. It's important to say clearly, these experiences are valid too, and they deserve support, not shame. The key distinction researchers and clinicians make is between situational emotional processing, which is normal, expected, and typically resolves with time and support, and clinical conditions like major depressive disorder or PTSD, which involve more severe, persistent symptoms that interfere with daily functioning and may require professional treatment. Here's a question worth sitting with. If most research shows no direct causal link between abortion and mental illness, why do some women still struggle so much more than others? The answer lies in something researchers call risk and protective factors, and understanding them might be the single most useful thing you take away from this video. The first major factor is pre-existing mental health history. Women who have experienced depression, anxiety, or trauma before the pregnancy are statistically more likely to experience emotional difficulty afterward, not because of the abortion itself, but because pre-existing vulnerability tends to resurface during any major life stressor. This is true of abortion, miscarriage, childbirth, divorce, or job loss alike. The second factor, and arguably the most powerful one, is social support. Multiple studies have found that women who have supportive partners, family members, or friends report significantly better emotional outcomes than women who go through the experience in secrecy or isolation. This single factor may matter more than almost anything else we'll discuss today. If you're listening to this as a partner, a parent, or a friend, please hear this clearly. Your presence, your non-judgmental listening, and your willingness to simply be there can meaningfully shape someone's emotional recovery. The third factor is whether the decision aligned with the woman's own values and circumstances, versus feeling pressured or coerced by a partner, family member, or financial situation. Women who felt their decision was self-determined consistently report better emotional outcomes than those who felt pushed into a choice that didn't reflect their own wishes. The fourth factor is stigma. Women living in communities or cultures where abortion is heavily stigmatized often report higher levels of secrecy, shame, and isolation, all of which compound emotional difficulty. This is not a moral judgment on any particular culture, it's simply an observed pattern. Shame thrives in silence, and silence makes healing harder. And the fifth factor is the quality of healthcare interaction itself. Women who are treated with compassion, respect, and clear information by their healthcare providers report better psychological outcomes than those who feel judged, rushed, or dismissed during the process. This is a powerful reminder that bedside manner isn't a soft extra, it's a measurable part of medical outcomes. Now that we understand what actually shapes emotional outcomes, let's clear up some of the biggest myths still circulating, because misinformation here doesn't just mislead people, it can actively cause harm. Myth number 1, abortion always causes depression. This is one of the most persistent claims in public discourse, but it's not supported by the weight of the evidence. Large-scale studies, including the Turnaway study and reviews by the APA, have found no consistent causal relationship between abortion and clinical depression in the general population. Some women experience sadness, some don't, but always simply doesn't hold up against the data. Myth number 2, post-abortion syndrome is a recognized medical diagnosis. This term gets used often, but it is not recognized by the American Psychiatric Association's Diagnostic and Statistical Manual, nor by the World Health Organization. What it often does is bundle together a range of unrelated symptoms, some of which may actually reflect pre-existing conditions, situational grief, or even symptoms unrelated to the abortion at all under one alarming label. That doesn't mean the symptoms some women describe aren't real. It means the framework used to explain them isn't scientifically validated. Myth number 3, if you feel fine, something must be wrong with you. This myth can be just as harmful as the others because it tells women who feel relief or peace that their reaction is somehow inauthentic or suspicious. But as we discussed earlier, relief is the most commonly reported emotional response in major studies. Feeling okay is not denial. It's simply one of many valid emotional outcomes. Myth number 4, therapy is only for people who are struggling. In reality, many women find value in talking to a counselor or therapist regardless of whether they're in distress, not because something is wrong, but because reflective support can help process any significant life event the same way people sometimes seek therapy after a major job change or relationship transition, even when they're doing relatively well. So now that we've separated fact from fiction, let's talk about what actually helps, because information without action only goes so far. If you're processing emotions after an abortion, one of the most effective tools is simply naming what you feel without judging it. Journaling has been shown in multiple psychological studies to help people process complex emotional experiences by giving structure to otherwise overwhelming feelings. You don't need to write something profound. Even a few honest lines a day can create space between you and the emotion, which often makes it more manageable. Talking to someone you trust matters enormously, and this connects back to that powerful protective factor we discussed earlier, social support. If you don't have someone in your immediate circle you feel safe talking to, peer support groups, many of which exist in confidential, non-judgmental formats, can provide a sense of connection without the fear of stigma. It's also worth paying attention to your body, not just your mind. Sleep, nutrition, and gentle movement all play a measurable role in emotional regulation, particularly during a period when your hormones are recalibrating. This isn't about pretending nothing happened, it's about giving your nervous system the basic support it needs to process a significant event. Now, here's an important distinction everyone should know. There's a difference between normal emotional processing and a signal that you need professional support. If you notice persistent hopelessness that doesn't improve over several weeks, intrusive thoughts that interfere with daily life and inability to function at work, school, or in relationships, or any thoughts of self-harm, these are signs that it's time to reach out to a mental health professional. Not because something is wrong with you as a person, but because your mind, like your body, sometimes needs extra support to heal. Reaching out is not weakness. It is, statistically and psychologically, one of the strongest predictors of better long-term outcomes. Depending on where you're watching from, support looks a little different, but it's accessible nearly everywhere. In the United States, many women find support through licensed counselors, their OB/GYN's office, or national mental health helplines. In the United Kingdom, the NHS offers talking therapy services that can be accessed through a GP referral. In Canada, provincial mental health services and telehealth counseling options have expanded significantly in recent years. In Australia, Medicare rebated psychology sessions make professional support more financially accessible, and organizations like RANZCOG provide guidance for both patients and providers. And across much of Europe, national health services typically offer pathways to mental health support, though the specifics vary by country. The point isn't to memorize every system, it's to know that help exists. It's often more accessible than people assume, and reaching out is a sign of strength, not failure. So where does this leave us? If there's one thing this research makes clear, it's that there is no single emotional script that fits every woman's experience after an abortion. Some feel relief and never look back. Some feel a complicated mixture of emotions that shifts over time. A smaller number struggle significantly and need additional support. All of these experiences are valid, and none of them make a woman wrong for feeling the way she feels. What the evidence consistently shows is this: the emotional outcome isn't predetermined by the procedure itself. It's shaped by the support a woman receives, the compassion of the healthcare she's given, the freedom she has to make her own choice, and the environment of understanding rather than judgment that surrounds her afterward. That's a powerful insight because it means that as a society, as families, as friends, we actually have real influence over how this experience unfolds for the people we love. Listening without judgment, offering presence instead of opinions, and treating emotional honesty as something to be respected rather than corrected, these are simple things, but the research says they matter more than almost anything else. If you take only one thing away from this video, let it be this: there is no universal right way to feel after an abortion, and seeking support, whether that's a friend, a journal, a support group, or a licensed therapist, is never a sign of weakness. It's a sign that you're taking your own well-being seriously, which is exactly what every woman deserves to do. If this video gave you a clearer, more compassionate understanding of this topic, consider sharing it with someone who might need it. Sometimes the most powerful thing we can offer another person is simply the knowledge that they're not alone. And if you'd like to understand more about how partners and loved ones can offer meaningful support through experiences like this, that's exactly what we're covering next.